Men's mental health has become a serious public health issue. Suicide rates for men are about 4 times higher than for women, and men make up nearly 80% of all suicide in the United States. That's according to the Center of Disease Control and Prevention in 2025. These numbers make us ask important questions. Why are men so much more at risk, and what can we do to change this? One of the challenges is that men are less likely to seek help. From a young age, boys are taught to man up or stay strong. This builds a cultural expectation that showing vulnerability is a weakness. At the same time, services like counseling often have long wait times, making it harder for men to get help even when they want it. To fully understand this issue, we can look at men's mental health through 3 disciplines: psychology, sociology, and public health. Each one gives us a different angle, and when we bring them together, we can see a clearer picture. From a psychological perspective, men tend to cope with stress and mental health struggles differently than women. Instead of showing sadness or seeking support, men may express anger or risk-taking behaviors. Studies also show that men are less likely to seek therapy, often because they internalize the belief that they should handle problems on their own. This makes diagnosis tricky too, because men's symptoms don't always match traditional criteria for depression or anxiety. Psychology helps us understand how these struggles play out in the mind of the individual, but it doesn't fully explain why they're so common across cultures. That's where sociology comes in. Sociology looks at a bigger picture, the cultural norms and the social structures that shape behavior. An example that I would like to use would be Mexican culture. From a young age, we are taught to be tough, strong, and for one day to be a provider. We never learn how to express our feelings. We just put our heads down and did what we were told. This creates a cycle where men hide their struggles and avoid reaching out for help. The sociological perspective shows us how powerful culture is in shaping men's mental health, but doesn't give us the clinical tools needed for treatment. The third discipline is public health. Public health looks at men's mental health on a population level. Suicide is one of the leading causes of death for men under 50, and research shows that most of those men had contact with a healthcare provider in the year before their death. That means there were opportunities to intervene that were missed. Public health also points out the lack of services for long wait times and the need for campaigns that actually speak to men in relatable ways. For example, outreach in places like gyms or sports clubs is often more effective than traditional clinics. Public health highlights these systems level barriers, but it sometimes overlooks the personal and cultural side of the problem. Now, if we stop at just one of these disciplines, we miss part of the picture. Psychology focuses on individuals, sociology focuses on culture, and public health focuses on systems. To really understand men's mental health, we need to bring these perspectives together. When we do, we see common ground. All 3 disciplines point to restrictive gender norms as a major barrier. Men are taught to suppress their emotions, which harms them individually, reinforces silence culturally, and shows up in population-level data as higher suicide rates. By building on common ground, we can design solutions that are more complete. One interdisciplinary solution is community-based men's health program. This would include 3 main parts. First, peer-led groups where men can share experience and challenge stereotypes together. Second, accessible counseling that recognizes how men often present systems differently and use gender-sensitive approaches. And third, outreach in familiar community spaces like barbershops or sports clubs where men already feel comfortable. The advantage of this kind of program is that it tackles a problem from multiple directions. It helps men personally, it challenges harmful culture messages, and expands access to care. Of course, challenges like funding and stigma still exist, but research shows that when support is embedded in trust community spaces, men are more likely to participate. In conclusion, men's mental health is complex. Psychology, sociology, and public health each give us vulnerable insights, but none of them can solve the issue on their own. When we integrate them, we get more powerful understanding and better solutions. To truly address men's mental health, we have to treat the individual, reshape the culture, and reform the systems that support him.